So you want to know, are self-care treatments good? Well, this video is all about self-care treatments and whether or not they're good. Welcome to HEALTHdrum. I'm Dr. Bert Worstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your medical needs. If this is your first time on the channel and you'd like to get fact-based healthcare information, please hit the subscribe button. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start sorting fact from fiction. So we just published a video, is self-care testing good? This is a follow-up to that question, are self-care treatments good? So self-care treatments or consumer-directed healthcare are good. It's all about self-care practices for physical well-being, mental well-being, self-care testing, and self-care treatments, as well as preventive health. Self-care is all about self-care practices or consumer-directed care, self-healing, and maintaining your health. Your body, your rules. So how has self-care treatment been enabled? Some 64% of Americans engage in self-care to some degree. This consumer-directed care has been enabled by access to unlimited healthcare information on the internet, as well as access to telehealth and digital health platforms, access to various healthcare apps, and access to self-care test kits and pharmacy consults. So what are some of the benefits of self-care treatment? There are several benefits to self-care treatment. You can treat your condition privately, it's convenient, it's time efficient, and it's cost efficient. It avoids the expenses associated with professional medical advice, and it avoids all the wait times associated with scheduling. As well, you can avoid being impacted by medical errors and over-treatment. So what are some of the possible risks of self-care treatment? These are some of the possible risks associated with self-care treatments, such as misdiagnosis, overuse or misuse of a treatment, a lack of professional medical oversight. Your treatment may need an alternative treatment, and a wrong treatment may mask signs of a worsening condition, and costs may increase if incorrectly treated. Although self-care may expose you to some risks, conventional medical care and alternative medical health options are also associated with a significant incidence of potential downsides, complications, and over-treatment. So when should you abandon or avoid a self-care treatment? So here's a screenshot of when to avoid or stop self-care treatments. When you have significant symptoms and signs such as a very high fever, great pain, shortness of breath, chest pain, or significant bleeding, or when symptoms and signs are very severe. Sometimes, however, there may be no choice but to carry on as best you can if there's no immediate access to professional medical care. So let's look at some ways where you can empower yourself about your medical concerns. So you can become relatively familiar with various medical concerns by accessing the internet for healthcare information. You can find information about diseases, tests, treatments, and the cost of care, as well as clinical trials, medications to treat disorders, and preventive and wellness material. So you can also use voice-triggered artificial intelligence or AI on Grok, Google Gemini, ChatGPT, Messenger, and WhatsApp to get a diagnosis or details about the medical or healthcare condition that you are concerned about. What about self-care treatments for chronic medical conditions? This is a screenshot of some self-care treatments for some chronic medical conditions or chronic disease conditions. This is probably the most important screenshot of this video. Sadly, the incidence of obesity is ballooning in this country, and obesity is strongly associated with high blood pressure, sleep apnea, and adult onset diabetes. So these conditions are all associated with lifestyle choices, and self-care is the most cost-effective step you can take to stay away from doctors and healthcare expenses. Self-care treatment of obesity by limiting caloric intake, adopting a healthy, balanced diet with portion control, and using diet trackers is ideal. These activities can also lower blood pressure and help control adult onset diabetes. And in addition, you should avoid drug intake and limit alcohol intake, as well as undertaking regular amounts of moderate exercise. So what sort of self-care treatments are available for emotional health? There are self-care treatments available for emotional and mental health, such as regular amounts of moderate exercise, meditation and yoga, getting adequate sleep, avoiding drugs and stimulants, and moderating or avoiding social media exposure. Excessive social media exposure has been shown to be harmful to teenagers. Are there any self-care treatments available for sexual or reproductive health? So there are several self-care treatments available for reproductive, sexual, and urinary health, such as over-the-counter medications for period pain, heating pads for period pain, lubricants for dryness, and baking soda sitz baths for yeast vaginitis. Baking soda is a cheap, easy way to get rid of yeast vaginitis. You throw a box of baking soda into a bath and sit there for 15 to 20 minutes. It will kill the yeast very quickly and get you on your way. This process is much less expensive than costly anti-yeast creams. Also, for urinary tract infections, sometimes these can be eased or cured by increasing fluids and or cranberry juice. And for those who are prone to urinary tract infections after sex, urinating before and after sexual activity can be helpful. Also, timed voiding for infrequent voiders with large residuals and recurrent UTIs can be helpful. Estrogen cream in postmenopausal women with recurrent urinary tract infections may prevent these recurrent infections. And for combating urinary frequency, minimizing bladder irritants such as caffeine is reasonable. Kegel's exercises are often recommended for urinary incontinence, but this maneuver is rather controversial as tests have shown that these pelvic floor exercises are ineffective. What about self-care treatments for minor injuries and minor illnesses? So many people are aware that there are many self-care treatments available in the drugstore for minor injuries, sprains, and illnesses, such as pain relief and items for wound care, dressings, and antiseptics. To control bleeding, you simply use sustained pressure on the site of bleeding. For sprains and twists and so on, you use ice, braces, splints, rest, and elevation. To control fever, there are many over-the-counter medications. As well, you can use cool baths, which can be helpful. There are other over-the-counter medications for treating cough, nasal congestion, and sinusitis. There are humidifiers available. A sore throat can be cured with gargling medications, and you can also gargle with liquor because of its high alcohol antiseptic abilities. As well, back pain and neck pain are extremely common, and various self-care treatments can help, such as TENS units or transcutaneous electrical nerve stimulation, which you can buy online or at the drugstore. What about self-care treatments for gut health and nutrition? There are several self-care treatment options for nutrition and gut health. Increasing fiber and probiotics or old-fashioned mineral oil are useful for treating constipation. Using Imodium or Pepto-Bismol for diarrhea, probiotics and or peppermint oil for irritable bowel syndrome or IBS, antacids or Pepto-Bismol for indigestion, and topical ointments and sitz baths for acute hemorrhoids. What about self-care treatments for lung function and breathing? Self-care treatments for breathing and lung function are available. There are several different types of inhalers which can be bought over the counter. as well as inhalers. Steam and humidifiers can provide symptomatic relief, and there are also antihistamines and cough suppressants. Also, avoid triggers such as smoking and other irritants, and stress management can also be very helpful. What about self-care eye treatments? There are several self-care eye treatments available for some common conditions such as a stye and blepharitis, which is inflammation of the eyelid. Warm compresses are helpful for these conditions. On the other hand, pink eye responds better to cold compresses. Dry eyes to artificial tears, which you can buy over the counter. Viral conjunctivitis is the most common form of conjunctivitis and responds to cold compresses. You can also ask the pharmacist for help, and if any of these conditions worsen, make sure you get professional medical advice. What about self-care treatments for skin conditions? So there are a number of skin conditions which respond to self-care treatment, and all of these supplies are over the counter at the drugstore. Rashes can be treated with calamine lotion or low-dose hydrocortisone cream and or antihistamines. Hives can be treated with antihistamines, cool compresses, and oatmeal baths, while eczema can be treated with cold baths or cold compresses. Antihistamines and low-dose steroid cream can be helpful. Athlete's foot responds to antifungal medications as well as 3% hydrogen peroxide applied twice a day for several days until gone. Also, acne responds to topical agents as well as 1% hydrogen peroxide. It's easy enough to get to 1% by diluting the 3% hydrogen peroxide, which you can buy at the drugstore. And finally, although not FDA approved, there are some clinical reports and enough proof of concept to show that superficial skin cancers can be treated with 35% hydrogen peroxide. I have published other videos concerning self-care treatment of skin disorders. How come some effective unconventional treatments are shunned, whereas some conventional but ineffective treatments persist? So there are unconventional medical practices that are safe and effective but have been blackballed by physicians. On the other hand, there are some ineffective conventional treatments promoted by physicians that seem to persist. There are many reasons for this, such as a reliance on beliefs, assumptions, and opinions, a reliance on outdated practices, studies designed to deliver positive results, and other studies designed to deliver negative results to badmouth a proposed treatment. However, mostly there's a failure of physicians and scientists to design studies that deliver irrefutable and reproducible data. As well, there's a very common problem impacting most clinical studies negatively, and that is the problem of financial conflicts of interest. What about a guide for self-care treatment practices? So a guide to self-care treatment concerns getting information from reliable sites, know when treatment is appropriate, use medical kit and supplies, use healthcare apps, and or ask the pharmacist for advice or get AI feedback. So you can buy a medical kit with some basics such as a thermometer and blood pressure monitor, Band-Aids, pain medicines, antacids, anti-diarrhea medication, antihistamines, sunscreen, antiseptics, antibiotic creams, and so on. There are various types of these medical kits, and you can compare them online and what you feel comfortable with. So what if self-care treatments don't work and you want to find a cash pay practitioner? So if you need to get professional medical help because a self-care treatment isn't working, cash pay care is ideal. Again, self-directed care, and you're in control and not some health plan. This is good to know since 80 to 90% of all the health care delivered is generally affordable, routine office-based or outpatient care. Many people use direct pay urgent care clinics, telehealth services, or digital health platforms such as HEALTHdrum. Feel free to reach out to me about any self-care tests or treatments that I've failed to mention and that you think are important. So let's recap. In this video, are self-care treatments good? You learned that there's a lot of information available about self-care treatments. Self-care treatments are empowering, and self-care treatments are time and cost efficient. To learn more about routine medical conditions, self-care, and digital health, check out these other videos. And feel free to reach out to me with comments.